So I am a full-time pharmacist and full-time businesswoman, but today I'm going to use my pharmacist head to educate you guys a little bit on medication, the good, the bad, and the ugly. So medication has three purposes. It has a treatment purpose, a prevention purpose. Let's get the next slide, please. And it has a management purpose. So in prevention, it's known as prophylaxis. That is to prevent a disease. You have things like vaccines or anti-malarial drugs that do this. In treatment, obviously it's to treat the disease or the condition. And you have like bacterial antibiotics, fungal, antifungal medication for that. In management, we normally manage long-term conditions. So these are conditions that can't be treated. They won't go away, but they are managed and the symptoms are kept on the level with medication. So things like hay fever, you use antihistamines or a series of things over the counter to manage your symptoms, which is one of the things that will be coming now. And you may feel cold-like symptoms, but it may be hay fever. And even if you've never had it before, you can actually acquire it at some time in your life. Or if you've always suffered with it, sometime it can just go. So prevention, it's intended to prevent disease. It can be a substance, a medication, or a device used to prevent a person from getting a disease, infection, or condition. I've given examples already. The product can be natural or from natural occurrence, or they can be synthetically made. As I explained before, this is to prevent circumstances. The best prevention is trying to keep a healthy lifestyle, but unfortunately, that's not going to exonerate you from every type of condition. There are things that are going to come up, coughs, colds, etc. You can try to keep as healthy as possible with good hygiene, but sometimes we need to aid these management of the symptoms or prevention of these symptoms with other things like antiseptic conditions and things like that. So in treatment, these are medical care that's given to a person for an injury or illness. Now, these are to effectively reverse or clear or tackle the condition, and the condition is no longer present. So when you're being treated for something, the idea of that is the condition is supposed to go away. Things like examples of things that can be treated. Malaria can be treated. Tuberculosis can be treated. All these types of infections can be treated. Some STIs can be treated. When it becomes a disease, it's more likely to be managed and it's more likely to be long-term. So management is the process of dealing or controlling a condition. As I said, you're not treating the disease itself, you're managing the condition. So when you have a disease, it will present symptoms. These are things that identify that you have this disease, whether it's a high temperature, whether it's feeling unwell, whether you're losing weight, whether you're hungry all the time. It can be as extreme as blood in stools and things like that. These are symptoms that you will experience when you have this disease. When it's effectively managed, it means that you no longer experience these symptoms. It doesn't mean you don't have the disease. You will still have the disease, but your symptoms are being managed. If you are still having symptoms when you are being managed with medication, it means that your disease is not being managed properly. To effectively reduce, settle, mask, or the condition so that the symptoms are no longer present. Okay? So purchasing medication. You can purchase medication from a pharmacy, or you can purchase it from online. You can purchase it online. I know a lot of people are purchasing it online now more and more, but I do want to just caution you with certain things that you won't get online as you would in the pharmacy. In the pharmacy, there's quality assurance. That means the product that you are getting has been quality assured. It means that it's definitely what is in the product. And there are a lot of fakes that are out there. There are a lot of falsified medication is what we call it. But now in pharmacy and in community, they have policies and procedures to make sure that what you are getting is the right thing. So please, if you are purchasing medication, try and purchase it from a pharmacy. Online, yes, you have quick access, but as I said, there are a lot of fakes out there. So please make sure that you are getting it from a reputable brand or reputable company if you are purchasing it online. In the pharmacy, you also get advice. So you can speak to the pharmacist, or there are dispensers who are also trained to an extent to give you some clinical information. If your situation is complicated or you have other ailments or minor ailments, then you can always speak to your pharmacist who will give you a clear idea of what to do. Symptoms differentiation. What I mean by this is that there are a lot of symptoms that overlap for different conditions. So you may think you have one thing, but the pharmacist will be able to tell you, pharmacist or doctor, will be able to tell you where it stops being this and it starts being something else. So if you do speak to your pharmacist, please, as much as everyone's pressed for time and it is busy, please tell them everything you are experiencing. There is one symptom that can sometimes mean a difference between being treated correctly and treated incorrectly. And just on this, I'll actually just give you a brief story. So a few years ago, well, for me, I have always had chest pain since I was about 13. And since 13, I just started experiencing the chest pain. I never knew what it was. I used to go to the doctor all the time. They'll say it's muscular, but it always felt like an impending doom. Now, this impending doom sense is what is described as a heart attack when you are having a heart attack. So me and my 13-year-old self, every time I had this chest pain, if I looked on Google, I would feel like, oh my God, I'm having a heart attack, and I would just cry. But I would never die, and I would never get any other symptoms of a heart attack, just that. So I was diagnosed with costochondritis, which is a muscular condition. It's just an inflammation of cartilage. You get a lot of pain with it. And it just means it's muscular pain, basically. A couple of years later, I experienced the same pain. And I normally go to hospital. My vitals are normal, and they'll just tell you, take this, it's fine. Take a painkiller, you're fine. It's costochondritis. This time, the pain was just as bad, but there was one slight difference. I became short of breath. Now, I'm chubby, but I generally try to stay fit. My breathing is not that bad. But when I felt laden, my breathing was laden on sitting, I knew that this was different. So I explained that when I went to hospital, and the consultant in cardiology almost wrote me off as too young for any other reason. It was definitely a costochondritis. By the grace of God, I was moved to a different ward the next day, and the consultant there looked at my file and she said, okay, you're young, but this should still be costochondritis. We're going to do one test, and we think it's going to be negative, but we're just going to do it in case. We did the test, and the test was positive. I had a PE, which for anyone who doesn't know, that's a pulmonary embolism. It's a blood clot in the lung. This gone unnoticed could be fatal. If I wasn't in tune with my body and I didn't explain all the symptoms, I could have walked away with just costochondritis on anti-inflammatory medication, just a painkiller, and dropped dead at any time. But because I did talk about all the symptoms, and because I was in tune with my body, I was treated correctly, and I'm still here. And by the grace of God, we'll have many more years. So it's very important to know your body. It's important to talk about all the symptoms, and it's important to please make sure you're treated properly. So online, as I said, the product is not always guaranteed, and you may not address any interactions or contraindications. What that means is if you're taking other medication, sometimes some medication does not go with other medication, which is called an interaction. Sometimes some medication does not go with other conditions that you have. That's called a contraindication. So you need to explain the conditions you have, to whom you're seeking advice from, and any other medication you're taking, be it herbal, whether it is a device that's implanted in your body, or whether it's something that you take once in a while. Please communicate all of that when seeking for help or new medication. So taking your medication. Getting the right medication is one thing. There are other factors that make sure that this medication works. The time of the day that you take it. Now, it's not for you to particularly know when to take it unless you read the instructions, but you can always ask your pharmacist if there's a better time of the day to take it. Some medications are absorbed better in the morning, some are absorbed better in the evening, or they work better in the evening. So the time of day is something that will affect how efficient a medication works. Food or liquids. Sometimes you need to take food on an empty stomach for it to work properly. Sometimes you need to take it with food to reduce side effects. Again, ask your pharmacist or diligently read the patient information leaflet that is inside every medication box. Spacing and frequency. Liquids. Please drink most medication with water. Try and avoid milk or juice because some medication don't work with that. For those who drink alcohol, you can have alcohol with most medication, but some medication are definitely not. So please check this equally. Spacing and frequency, this is about the dosing, how frequently you take the medication, and it's important to stick within that timeline. If you do it too far apart, the amount of medication that's in your body will reduce to a point where it will not work even when you take the second dose. So for a medication to be effective, sometimes it needs to have an add-on effect. So if you take paracetamol at 8 o'clock, you know that the window is 4 to 6 hours for you to take the next dose. If you take it 8 hours later, your body has gotten rid of the first part, and therefore you won't experience the full effectiveness of the second dose. So taking it within that time frame is very important. If you take it too close together, you can build up a toxic amount of medication in your body. So don't take it before it's due. Just stick to that window. Some have a wider window, some have a more narrow window, and that can actually express how toxic and how bad it can be, or how non-effective it could be. Manipulating the formulation. Many people are not great at swallowing tablets and maybe prefer them in liquid formulation. If they don't come in liquid form, please ask your pharmacist if it's okay to break the medication or dissolve the medication. Not all medication can be broken or dissolved because it changes how they work based on where they're absorbed in the body. Storage, of course, keep out of the reach and sight of children. Most medication are supposed to be stored below 30 degrees. Thankfully, in this country, we don't really get up to that temperature, so wherever you leave it in the house is normally okay. But consider your heating. Consider if it's too cold. Again, there is a low temperature of 2, so not below 2. They shouldn't be kept at that temperature. If they do need to be stored in the fridge, please keep them in the fridge. Avoid the door of the fridge because as the fridge is open and closed, that temperature does change and alter. So put it somewhere inside the fridge, preferably the top shelf. So do's. Read the instructions, please. There's a small instruction on the front of the box if it's a prescribed medication. It will have your name on it and it will tell you exactly what to do. Take 1 daily, take 2 daily, take 1 twice a day. Take 2 daily and take 1 twice a day are 2 different things. Take 1 twice a day, that means take 1 tablet at 2 different times in the day. And take 2 daily means take the 2 together once in the day. So please read the instructions, and if you're not clear, please ask. Take them as prescribed or advised, and make sure you finish the course. So especially when it comes to antibiotics, the only way they can be effective is if you finish the entire course of them. If you fall short and don't finish the course, you are opening yourself up to resistance, which means that the medication will not work when you need it again. Look out for side effects and report these. So I spoke about knowing your body. There's one thing having the condition and not feeling well with whatever condition or illness you have. But if you start to experience another symptom, it is important for you to express this, especially after starting a medication. Now, I say read the information, the leaflet that is involved in the box, but unfortunately, pharmacists, the pharmaceutical companies have to write every theoretical possible side effect in there. So don't be scared when you see it, or when you see what side effects the medication will have or could have. They're all possibilities. Everyone works differently, so it doesn't mean that you will for sure have these side effects. It means it's a possibility. So read them, understand them, and if you have any of these, report them. If it's not a side effect that's listed, but you still have something that's different to what you would normally be experiencing, please also report it. Seek advice if there are no changes or if it worsens. And I say reasonable time frame. Please don't take a medication on Monday morning after you've been sick from Sunday and expect to be better by Monday afternoon. It takes time to work. There are doses that need to take effect, and your body needs to adjust. But if after 3 days you're not experiencing any change or it's getting worse, please seek medical help. Avoid Chinese whispers. Now, what I mean by Chinese whispers is when a friend tells a friend that this is what I took because when I had this, or my doctor gave me this one when I was everybody is different. Your condition is going to be different. Your treatment is going to be different. Sometimes it's the same thing that they prescribe because that is what is intended for that person.